CO-4 denial means procedure code is inconsistent with the modifier used or required modifier is missing. In simple words, either the modifier is missing or wrong modifier was used, or CPT and modifier combination is invalid, or payer expected a specific modifier but claim was submitted without it. This is a correctable denial and usually gets paid after proper correction and rebill. CO-4 usually happens because of missing modifier 25, missing modifier 59, missing RTLT, missing TC26, wrong XE/XS/XP/XU modifier, wrong surgery modifier, incorrect professional technical billing, modifier not matching payer policy, coding team forgot modifier, clearinghouse stripped modifier, duplicate CPT needing modifier, bundled procedure issue. To identify this issue, you check EOB and coding guidelines and ask yourself, was modifier required for this CPT? Is there bundling issue? Is it separate procedure? Check denial reason and payer policy. Now question is, how to fix CO-4 missing modifier denial? To resolve this denial, first you should review the CPT code, then check the medical notes or documentation, and then check CPT build, modifier build units, POS provider, specialty rendering provider, DX pointers, claim frequency. Now compare original build, claim, EOB denial reason, coding notes, and find the correct modifier like modifier 25, 59, etc. After this, correct the claim and modifier, and finally resubmit the claim. And if you already billed correctly, you can send appeal with proof